My name is Kiran Kumar, and I am the Executive Director at Walk Sacramento. Walk Sacramento is a coalition lead for the broader Design for Active Sacramento coalition. And as a Plan4Health grantee, our focus is on physical activity. Today I'm going to be sharing with you one of our more successful approaches to better integrating health into the planning process. So first I'll start with a little background on who we are and what our goals are as a coalition, and then more specifically under Plan4Health. So ultimately, Design for Active Sacramento's goal is in advancing implementation of active design. Active design is a built environment approach that encourages and facilitates more regular physical activity by looking at land use, transportation, building design, and health more holistically. Design for Active Sacramento began as a cross-sector team of planners, engineers, public health professionals, and then private healthcare physicians who are all committed to improving chronic disease rates in Sacramento. Under Plan4Health, Design for Active Sacramento is expanded to include partners such as AARP, the Institute for Local Government, the California Governor's Office of Planning and Research, and many others who are dedicated to a health in the built environment approach. So under Plan4Health, Design for Active Sacramento takes a multi-pronged approach to integrating health into the planning process and addressing chronic disease through physical activity. We believe that in order to truly advance population-wide health outcomes, not only do policies have to be in line and decision makers be educated, but planners, public health professionals, and community residents must all be working together collaboratively. So the photo to the left is an article about our work empowering youth voices within the planning process to discuss health inequities in their communities. And then the bottom logo here is from this year's APA Sacramento Valley Chapter's Professional Development Speaker Series that Design for Active Sacramento worked intently to focus entirely on health in the built environment. So what I'll be talking about today is actually one of the first things we did under Plan4Health, which was bringing together the region's planning directors and public health officers to meet and collaborate, sometimes for the first time. So we realized early on that the region's public health officers were in regular communication with one another and were interested in getting more involved in the planning process. But they did not have those relationships with planners and local agencies. So we saw this as a necessary first step in developing a regional dialogue and approach to health in the built environment. It's also worth noting that although our Plan4Health grant is focused on Sacramento County, we realized that the health and, to a degree, planning dialogues in the region were actually happening at that regional level. So through an extremely collaborative approach and process within and outside of Design for Active Sacramento, we worked to bring together over 75 of the region's planning and public health decision makers together to start identifying opportunities for collaboration. So the half-day event was hosted fittingly at our MPO, the Sacramento Area Council of Governments. And so all of these logos down here are all of the planners or of partners who we worked together with to bring about this event. So the first step in driving collaboration was really understanding how folks were already collaborating. So in partnership with the Sacramento Valley chapter of the American Planning Association, we surveyed planners and public health officers on their current role within one another's work. What we found was that very few people were regularly working across sectors, but were interested in knowing more about ways that they could be collaborating. So the majority of collaboration was happening on larger initiatives like comprehensive plan updates and regional planning projects, but not the more local day-to-day processes that do, at the end of the day, have a big impact on health outcomes. So the event brought in speakers from the Governor's Office of Planning and Research, the San Francisco Federal Reserve Bank, and the Local Government Commission to discuss best practices, opportunities for collaboration, and then new policies and funding that really focused on this collaborative paradigm shift in the planning and health world. So the bulk of the day, though, was spent on having planners and public health officers from the respective counties meet one another, share their work, and then identify short and long-term opportunities for working together. And then Design for Active Sacramento was also really intentional about surveying the folks in the room to really understand how Design for Active Sacramento's work under Plan4Health could help advance some of the things that we were talking about in the room. So really looking at what sort of technical assistance would be most effective in continuing these collaborations. So as a result of the convening and then some additional follow-up technical assistance, we're starting to see short and longer-term collaborations starting to get off the ground. So we've had planning departments call upon their public health counterparts to get more involved in making the case for health-promoting policies. And then more significantly, for project-specific health data on transportation grant applications. It turned out that over 22 applications within the region for the California Active Transportation Program were really intentional about reaching out to their public health officers and public health counterparts for that data. Especially in the area of grant applications, this is a place where we've seen almost zero collaboration between the health and planning departments. Finally, our partners at the California Conference of Local Health Officers, or CCLHO, who are kind of housed at the California Department of Public Health, they've taken our approach in Sacramento and recently expanded it to start driving a more statewide conversation. So in September, they held a statewide convening in Monterey where they engaged, I think, close to 16 different counties, bringing together those public health officers and planning directors. So this final slide is just a couple of really great photos from the event. You'll see elected officials from Sacramento, our MPO CEO addressing the room, and then public health officers addressing representatives from the American Planning Association, the American Public Health Association, and then a significant number of local planning directors and public health officers. So really speaking volumes of the collaboration that day was able to spur. And then so with that, thank you for your time. Again, I'm Kiran Kumar with Walk Sacramento. I really encourage you all to check out our page on Walk Sacramento's website where we host all of the materials, not just from this one event and one approach to Plan4Health, but our entire Plan4Health project. So thank you so much.